G'day and welcome back to the channel. So in today's video, I want to show you what you need to do to permanently fix an anterior pelvic tilt. And as the topic implies, not only do I want to give you some strategies that you can use to improve your anterior pelvic tilt, but we also need to have a conversation about why that anterior pelvic tilt is there in the first place. Because ultimately, if you want to permanently fix an anterior pelvic tilt, then we need you to change something about you or your environment to give it the space to be normal forever. So let's get into it. So the first thing that we need to get to truly understand how you can permanently fix an anteriorly tilted pelvis is we need to get a sense of how much your pelvis tilts, but also give you a strategy to help you get it back into a more optimal shape. And one of the really interesting things about this area is that when you stand up nice and tall with your feet dead straight, if you squeeze your glutes and just tense your butt cheeks, what you might find is that you may go from an anteriorly tilted position to a more neutral shape. And for me, clinically as a physio, I don't like telling people to tuck your bottom underneath you because there can be the tendency to go from an anteriorly tilted position at one extreme to a posteriorly tilted position at the other extreme. And that's not necessarily what we want. We want you to be in a more neutral position where if you can imagine that your pelvis is a bowl filled with water, we don't want the water to be dumping at the front. We certainly don't want the water to be dumping at the back. We just want it to be perched mid-range in between. Because again, if your pelvis is anteriorly tilted, we see that that can be closely associated with pelvic floor dysfunction. We might see some incontinence issues or some erectile dysfunction issues, or because the back of that pelvis is pulled upwards, we can then see that it compresses the lower back a little bit more or lengthens those hamstrings, potentially setting those areas up for their own individual dysfunction. Compare how that feels now to how it then feels after doing each one of the exercises that we're going to get to. And speaking of which, the first is probably the most powerful way to make it easier to get out of an anterior pelvic tilt. So once you've established that initial baseline and you've got a really good understanding of how much your pelvis is tilting and what it feels like to be in a neutral position, the first and potentially most important thing that we need to conquer to give your body permission to be in that position more consistently is loosening up a lot of the unnecessary tightness at the front of your hip and down through the front of your thigh. And the reason why this is just so important to master is that anatomically your hip flexors anchor to the front of your pelvis and then down onto your leg. What they have a tendency to do is if these tissues are tighter than they should be, they can pull down on the front of your pelvis, tilting you forwards. So what we want to get you to do is we want to give you a series of stretches and mobility exercises that you feel unglue or free up or take the handbrake off the front of your pelvis and the front of your thigh to feed some slack back into the system to allow you to be in a better position more consistently without being constantly pulled out. And the first exercise, again, is a very simple one. It's essentially just a kneeling hip flexor stretch. Now, obviously, if it's uncomfortable for you to put your knee on the ground, you can do this sitting off the side of a seat. You're obviously welcome to put something underneath your knee if you would like to. But how this looks is we want you to be up nice and tall. Again, if we can squeeze your butt cheeks to try and put your pelvis in a good position, because keeping your trunk up tall, we want to try and shift everything away from your back knee. We don't want you to arch backwards or lean forwards. We want to try and keep you vertical the whole time with your butt squeezed. As we push you forwards, we're trying to open up the front of that pelvis, the front of that hip, and you can shift your hips from side to side to go looking for which sort of angle and direction gives you the best access to some of your hip flexor or anterior chain tightness. Once you've found that good shape, we can get you to squeeze that tightness for 5 to 10 seconds. Again, this is that PNF stretching. It creates a reflex in your brain that when you stop tensing, it should immediately feel looser to some degree, which should then give you the capacity to immediately go further into the stretch than you could before. So we obviously just keep repeating that process for 5 to 10 seconds until you either get sick of that or you stop making change. And then what you should hopefully find is when you come back to your pelvic tilt assessment, you should feel like it's easier to get back into that position, but just by feeding some slack into the front of your hips, you should then feel like you're in a more naturally comfortable, neutral pelvic position. And while the hip flexor stretch is a really, really good one, we also need to make sure that we're looking after some of your quadricep tightness as well. Again, anatomically, that rec fem muscle attaches from your knee right into the tip of your hip bone. If that's also tight, it can again contribute to you dumping forwards into that anteriorly tilted pelvic position. And again, one of the best ways to mobilize all the tissue at the front of your hips and down into your thighs is the couch stretch. So as always with the couch stretch, getting your knee back into the corner of something and then coming up into this high kneeling position is an amazing way to find and mobilize a lot of the tightness through the front of your hip down through the front of your thigh. You are absolutely welcome to do this on a chair or a couch, as the name implies. But whichever version of this you feel able to do to start with, we need to squeeze any of the tightness that you feel. That may require you to push your foot back into the surface that it's leaning up against. Again, for 5 to 10 seconds, let that relax. You might find you can immediately go that little bit further into the stretch than you could before. Repeat that process again until you feel like you've stopped making change or you've had enough. If you can find some of that muscular restriction that might be bringing the front of that pelvis down into that anteriorly tilted position, there's another strategy that we can add on top of all of that just to clean up what might be left over. So another great strategy that you can use to go looking for and mobilize any extra restrictions to the front of your hip is just by using a ball, whether it's a tennis ball or in this case a lacrosse ball. If we can locate the bony bump at the front of your hip, and from there, if we come inside of that and then lie down on your stomach, on the inside of that bump, just moving it up and down, you might be able to locate some spots that feel a little bit thick or a little bit restricted. And what we can do is once you've found something, we can squeeze your butt, squeeze your tissue underneath that ball for 5 to 10 seconds. When you give, it'll relax. You might be able to sink in a little bit deeper. And then you can go hunting up and down that line inside that bony aspect, looking for anything that you feel is reasonably tight and getting that to tense and relax. And the added benefit of this is not only can we be on the inside of that hip bone looking for those hip flexors in that sort of channel, we can also come below that hip bone and off to the side a little bit more, going hunting through some of the other hip tissue like your TFL or your rec femurs that attaches into that hip to look for any muscular tightness that could be contributing to this phenomenon. And you can systematically work around looking for anything that you feel is tight enough or restricted enough to again be pulling down on the front of that pelvis, dumping you into that anteriorly tilted pelvic position. And then once you feel confident that you've mobilized some of those hidden restrictions at the front of your hip and thigh, we can then turn to activating the right muscles and getting you stronger in certain positions to give you a better chance of maintaining that neutral pelvic shape. So for me as a physio with my patients, one of the most important aspects of trying to correct an anterior pelvic tilt forever is that we need to get your brain and your musculoskeletal system to feel more comfortable holding that position more naturally. And one of the main muscle groups that help with that are your abdominal muscles. They anchor to the front of that pelvis and can do a great job of holding the lip of that pelvis up. So what I want to do in this section is I want to show you how I teach people to engage their core muscles to allow you to let your butt cheeks go. Because you obviously can't perform the things that you need to do if you're walking around with your glutes squeezed, and get you to practice that in a range of different situations to retrain your body to hold that pelvis in a better position. So how this looks, if we can get you just to lie down comfortably, and again, we're coming back to that bony bump at the front of your hips. What I'd like you to do is once you've found that bony bump at the front, just roll your fingers over the top of that into the fleshy part, more sort of towards your belly button. And if you're nice and relaxed and dig in there, this is a great spot to feel your core muscles working, to give you that feedback to make sure that you're doing the right thing. And how I like to teach this is if I can get you to take a comfortable breath in first. What we want to do is as you breathe out, I want you to think of drawing your belly button in and up towards your spine. And we don't want it to be like a real maximal contraction. It's probably a 20 or 30% activation. But what you should feel is when you've taken that comfortable breath in and breathe out and draw that belly in and up, you should feel the muscles under your fingers harden. Now it's a different feeling to if you're about to do a sit-up and you're squeezing your abs and bearing down. That's a more superficial, over-the-top squeezing feeling. This should feel like a gentle drawing in and a lifting feeling that tenses up or hardens the tissue where your fingers are. And the basic requirement of this is that you should be able to maintain that activation and then continue to breathe consistently. Because again, your ability to maintain a stable, strong, well-activated trunk should not be divorced from your ability to breathe. They should be able to happen independently of each other. It shouldn't be either or. And then once you feel you've mastered that, we can get you to squeeze your glutes to put your pelvis in a good position. We can then get you to draw that belly in and up to maintain that position. I'll just get you to bridge up and down. But we need to make sure that you're doing all of that at the same time and not losing it in any way. Because as soon as you feel like you've lost that activation of your trunk, or you feel like you've stopped breathing, or you feel like your pelvis is deorientated again, we want you to stop, come back to normal again, draw your belly in, and then go back to doing that again. And then once you feel like you can integrate that system really well and you don't feel like you're losing that, then we can start to progress this into harder, more dynamic, and more challenging situations throughout your day-to-day life. Obviously, we want to get to the stage where you can do this in standing. We want to be able to do it when you're walking around. But as I said at the top of the video, if you've worked on your ability to improve that pelvic tilt position, there's no guarantee that it's going to stay that way if you don't then take an additional step back to consider why the front of your hips have become tight and why those core muscles have deactivated to some degree and aren't just doing the things that they should be doing naturally. As someone who is actively trying to better understand why the things that happen to the body, the single biggest reason why hip flexors tend to be tight in the first place is ultimately a consequence and a legacy of all the sitting that we tend to do throughout the day. Just by the sheer fact that we're often stuck in this sort of 90-degree shape, and we're not often expressing sort of full range of motion out of that shape into extension. By being stuck in this hip flex position for hours and hours throughout the day, whether it's sitting at the kitchen table to have breakfast, sitting in the car to drive to work, sitting down at a desk, then ultimately getting in the car to go home, and then sitting on the couch to relax from all the sitting we've done throughout the day. Even if that isn't you specifically, there's just so much opportunity to sit throughout the day, to do the things that we need to do throughout the day. So if we aren't taking a step back to A, appreciate that fact, and B, try and mitigate that as best as possible, then we may never get to the stage where we can stop asking those hip flexors to be tight and restricted. And while it's unreasonable to expect everyone to stop sitting altogether and stand all day, but if we can't change something, then you will not see long-term progress with your anterior pelvic tilt. So what I would ask you to consider is the first step is just to take note of all the moments throughout the day where you feel like you're in this shortened hip position. Just try and capture the things that you do the most and then rank them from the most amount of accumulated time throughout the day to the least. And then take the top few and just see what allowances you can make to try and optimize that. If you do have to sit at a desk all day and you do have the capacity to stand more, please do. If you know that when you get home after a hard day and you love to relax and watch TV, maybe consider lying down on the floor or lying on the couch with your legs out straight as opposed to again being stuck in that 90-degree hip shape. But obviously we can't have a specific conversation as it relates to you until you get a very strong sense of where you might be finding these situations the most throughout the day. And if I can make this connection meaningful enough, then you can intuitively make really great, strong decisions to get you closer to a standing hip extended position than you might otherwise have been without realizing. But I want to stress, if we want to permanently fix your anterior pelvic tilt, then something about your day-to-day life, your routine, the way that you load up your body has to change to then get a different outcome. So ultimately, I genuinely hope, as always, that was helpful and insightful. If it was, please let me know in the comments down below. Let me know your thoughts on what we've just gone through. But as always, I sincerely hope that was helpful for you and hope to see you next time.